Hey, it's Walt Medlin of Bariatric Medicine Institute, and I'm here doing part 2 of our gastric bypass conversion talk. I know Dr. Cottom did an introduction, and I just want to say how excited we are to have good tools now to convert old gastric bypasses into stronger operations. Revisional surgery has really always been very hard and tricky. But now we have tools where we're able to do things a lot safer than in the past. For most people who've had an open gastric bypass, we can convert it laparoscopically, either to duodenal switch or to something like a duodenal switch, which is called a TALL, which is basically shortening the amount of bowel that you use, similar to duodenal switch, but without quite the amount of reconstruction. So that's very effective. Any revisional surgery, you have to be careful about expectations, and the consultation is really important, that we are all on the same page, that we have all the ducks in a row, especially things that people don't think about, like sleep apnea that's untreated that can lead to appetite increase, or medications that can lead to appetite increase. We really need to sort of do a deeper dive and make sure that we have the behavioral cues lined up so that things aren't working against you in terms of old habits or sometimes misconceptions, misunderstandings about what's good or bad, and sometimes some habits that people got into because they just had to do certain things for survival mode, if you will. People who had a lap band who were very tight sometimes got into nibbling more. We have found a few people with gastric bypass who got into a nibbling type behavior because they were having dumping, and that's one of the main reasons to do conversion from bypass to duodenal switch or to sleeve, is because of a dumping syndrome. And so people get used to try to keep their blood sugar level by eating all the time, and we kind of have to look at the behavioral side of that as well as the biological side of that. So it's a fair amount of work with revisions, but they're very effective and most people are super happy. And then, of course, revising people with gastric bypass who've had ulcer disease is super common. And unfortunately, a lot of people used to just have to be reversed, and now we can go forward to a more durable, more effective operation that does not have as much ulcer risk. So that's another reason to come see us. But again, consultation, expect a little more than your first consult if you just had an original surgery, because there's more moving parts and there's more considerations and there's more things you need to understand too for risk with a revisional operation. But again, we're very happy to be a very experienced program at this, and we've learned a lot from the titans whose shoulders we stand on as well. So hope that's helpful. We look forward to talking with you in person on telemedicine and in person, as we usually see people when we do endoscopy before surgery. But if you're traveling, sometimes we do meet people face-to-face the day before surgery, but we have plenty of interaction, and hope this is helpful, at least as an introduction to our side of this. And please don't feel intimidated to get a consultation. It's not a commitment to having an operation. It's more just finding out your specific information and our specific approach. So thanks, and look forward to meeting many of you.